Programme Committee. We've got a fairly full agenda, so we shall plough on. We've had apologies from councillors Adam Davis, Chris Holly and Sue Jones and Matthew Jones, and also from co-opted member Beth Allender. Do we have any other apologies from committee members at all? No? Okay. Can I welcome Councillor Jess Pritchard? Is she online? I think she is.
She is, Chair, yeah.
Yeah, welcome to just join the committee following membership changes at the last council meeting. And for the benefit of those who've joined the meeting online, I'm going to ask people in the room to introduce themselves so that people know who's here. So I'm Councillor Peter Black and I'm the chair of the committee, and I'm going to go on my left.
Good afternoon, everyone. My name is Bridge Madhar from the Council Scrutiny team.
Good afternoon, everybody. I'm Councillor Peter May and represent the Uplands Ward.
Simon Jones, Social Services, Performance and Strategy.
Marie Muldoon, Housing Options Manager.
Sarah Jordan, Landlord and Community Housing Services Manager.
Steve Porter, a Principal Officer in Homelessness.
Carl Morgan, Head of Housing and Public Health.
Councillor Wendy Lewis on Olive Ward.
Good afternoon, Samantha Jenkins, Democratic Services Officer.
Hello, I'm Edwin Jeremiah, solicitor employed by the council.
Okay, thank you very much, everybody. So item 2 is disclosures of personal and prejudicial interest. Does anyone have anything they want to disclose or at all? I'm going to take that. No, that's quiet. It's okay. Item 3, prohibition of whip votes and declaration of party whips. And item 4 then is the minutes of the last meeting, which was the 14th of October. So I'll just go through for those for accuracy, starting with page 1, page 2, page 3, page 4, page 5, and minutes as a whole. Are we happy with those? Thank you very much. Okay, public question time. I don't think we've had any public questions at all. So we shall move on to the scrutiny of the Public Services Board, of Swansea Public Services Board. We have a cast of thousands. Welcome to Councillor Andrea Williams, who's the Leaders Representative and Chair of the PSB, who's online. Karen Stapleton, I think, is also online, Deputy Executive Director of Planning and Strategy and the Vice Chair. She with the Swansea Bay University Health Board. I think we have Craig Flannery, Assistant Chief Fire Officer, and Hugh L. Manley, the Head of Operations, South West Wales Natural Resources Wales. We also have Richard Rowlands, who's Strategic Performance Manager, and Leanne Ahern, the PSB Support Officer. Have I missed anybody? I don't think I have. Thank you. Okay. So we've also got attendees who have been co-opted onto this committee specifically for this this item. So we have welcome to Sherry Bija again, and I think we have Councillor Gwyn Wigley Evans from the Mid and West Wales Fire and Rescue Authority, who's also here as well, helping us to carry out scrutiny of the PSB. So the committee is currently reviewing the performance of the Swansea Services Board, Public Services Board, its effectiveness and the differences made. We take this every 6 months, and following on from the last session in May, we're continuing that discussion. You'll see from the agenda papers there's a short cover report providing background to this item for the committee's benefit, which also sets the scene for the planned discussion. Andrea, do you want to sort of say a few words introducing this before we go into any questions?
Yes, please, Chair. Just very briefly, it's just really great to see representation across all the statutory partners of the Public Services Board here today. And I will no doubt defer to them for the steps that they're leading on to update the committee today. But really great to see such strong representation and support. It's been a comprehensive report, but we're very happy as always to take questions, Chair.
Lovely, thank you very much, Andrea. So I'm going to start with the first question from Councillor Mike White on progress. Mike.
Thank you, Chair. Yes, my question is regarding overall progress. What have been the main achievements of the Swansea PSP from April to September 2025? More generally, can you provide examples of notable improvements either in how the PSP operates or in relation to these specific PSP objectives? Thank you.
Thank you, Mike. Andrea, I'm going to refer to you. You can pass on to people as you go. You can conduct the inquiry if you like.
Thank you, Chair. Yes, just my initial observations, and thank you, Councillor White, for the question. I do think that as a public services board, we're operating really efficiently these days. We've got a very clear wellbeing plan and wellbeing objectives and clear steps. And a clarity over who are leading on those steps as well. So we are operating probably as most efficiently as we ever have done. So that's really positive from my perspective. So if I could probably go to the step leads and ask them if they want to update and pick up anything that might not be picked up, as it were. So for early years services, I'll go over to Karen.
Karen?
Thanks, everyone. So in the first quarter, one of the key things that we set out to do that we've achieved is to progress the phase expansion of early years provision. So that's the 2.5-hour additional funded per day childcare. So we did the work in the first quarter to get ready for that, and that's been implemented since September this year. So we're now monitoring uptake of that additional offer for families across Swansea. So that's one of our key achievements in early years area. The other one is that we're working as part of the Welsh Government with our national Welsh Government teams to create a dashboard for our area to track the needs of families and children. So we can use that data to then support how we then target our health visiting services to support families better. At the moment, it's a quite old historical model of health visitors per number of the population. But the more we understand the needs of our families, the more we'll be able to sort of identify needs and really focus it. Alongside that, we are looking to roll out our childcare offers through libraries, through schools, to raise the awareness amongst families, and so we can again make sure we're targeted the right families. So in the first quarter, that's some of the main things we got on track to report. Thanks.
Thank you, Karen. And if I could go to the next step, which is council-led, which is the human rights city status. We've developed and shared a self-assessment framework for the PSB organisations. We promoted human rights awareness amongst probation staff and offered voluntary sector training. And the sign-off and the implementation has begun for the Health Board Strategic Equality Plan, which is related to this particular step. So perhaps if I can go to Howell to take us through the net zero and nature recovery. Howell, over to you.
Lovely, thank you, Andrea. Yeah, I think in terms of net zero nature recovery work, I sit on 4 public service boards, and I've got to say the partnership working that's happened across Swansea PSB has been remarkable, and the work taken forward in collaboration. There was work commenced last year on the climate change risk assessment, taken forward in partnership with kind of local authority and NRW being the key leads on that work. It involves something like 13 public engagement events right across the Swansea area. Well, that helped them to form a plan on the work and the concerns that your residents really had around the climate and the impact that was having. That's accumulated in a plan now, an action plan to take forward and to help support the vision of the people of Swansea in how we take that work forward to try and tackle those various actions. A lot of it is around improving public health in some areas and air quality issues. Some of it's more about focusing some of the nature targets that can be done. Focus as well around kind of green spaces, urban spaces in the more populated areas of Swansea. Work also undertaking looking at kind of how can you use those green spaces to reduce surface water runoff, and overall kind of an ambition of the plan that the public want to see implemented within the city and county of Swansea. There's naturally a challenge around kind of how you fund all those improvements, but it gives basically a very good document to help bid for potential external source of funding as and when the appropriate measures arrive. So that's probably been the key achievement of the work. But please, a few lines doesn't really cover the work that's been put into pulling together this the climate change risk assessment that's been prepared and the work that's gone into that. Thank you.
Thank you, Howell. And if I could go to Craig to update on community safety and cohesion. Over to you, Craig.
Yeah, good afternoon, everybody. And yeah, just need to say just a big thank you to Roger Thomas. You may be aware he recently retired. Roger was the step lead in this regard for a number of years. So I'm the new boy on the block. So just in terms of community safety and cohesion then, and I received some councillors on the meeting today who will have attended this back in the summer. We hosted the Community Safety Village, which you will be aware that we've done for the last couple of years. But this year we had over 400 attendees, and we also had new partners joining that Community Safety Village. So new voluntary sector partners, some additional kind of blue light orientated voluntary sector, as well as other partners, all with the opportunity to share their offering with the community visiting. It was the Firefighters Challenge. It has gone from bigger to better every year, and we hope to be hosting that again next year. Furthermore, Steve Jones has been continuing to do the work in relation to the police safety staff and hoping to integrate that with the council into the city centre by spring of 2026. And probably just the final thing from me, just to keep it nice and succinct, is that just to give the assurances that the continued youth engagement through school programmes and various different key stages continue both from a community safety perspective and a fire safety perspective as well. So I'll stop there. Thank you very much.
Thank you very much, Craig. And so in terms of the integrated cultural offer, that step is progressing really well with Swansea cultural strategy, with public and partner input. We've expanded the community-led cultural events and promotion of the Welsh language and heritage, and we've advanced partnership discussions with Sports Wales and regional sports bodies. So I don't know if Richard wants to come in on the last three steps. So there's updates, Richard, or I'll give those updates. So we've got a quick update on the population wellbeing monitoring. So we've launched a regional data portal with Neath y Talbot and Cwm Taf Morgannwg PSBs. This will provide a single source of wellbeing data, which is available to partners and is also available on our Swansea Public Services Board website if councillors are interested in seeing that information. Personally, I think it's a very powerful tool and helps us to see where Swansea sits in comparison with other local authorities as well. So quite an addictive thing. So just be mindful when you go on it, you'll want to look at it all the time. And also we've developed 23 priority indicators aligned with Swansea's wellbeing plan with dashboards which will be updated quarterly. In terms of stakeholder and public engagement, it's been mentioned about the safety village, and there have been other community events which have been delivered, and a lot of consultation for the cultural strategy as well. And we published accessible reporting, including a British Sign Language video of the Public Services Board annual report. We held a successful PSB partnership forum back in July. With interactive workshops and positive feedback. We've developed an engagement plan to strengthen collaboration and improve public awareness of the work of the PSB. And finally, in response to this question, in terms of external support, we've used Welsh Government funding for a consultant-led project to sharpen the PSB priorities and to help accelerate delivery using the total place approach, which has been used elsewhere quite successfully. So I'll pause there, Chair. Thank you.
Thank you for that very detailed answer. Mike, have you got any follow-up questions?
No. All I would say, Chair, in regards to the issue with the early years is that we have seen an issue where, because of the way the boundaries are done for certain schools, this is where certain children are missing out. So I don't know if any follow-up work can be looked at there by the board.
I think you're talking about Flying Start, are you?
Yes.
Yeah. Do you want to comment on that, Andrea? I know it's not down to us really, is it?
No. I don't know if any statutory partners have got any comments on this, but we could take that away and have a look at it and possibly bring a written response.
Yes,
Yeah, that would be great.
It's been a long-standing problem with flying stock because you have set boundaries, and there's always going to be people who are outside those boundaries who should be able to get it, I suppose. So okay, that's great. Okay, so next question, Lyndon, you want to declare an interest before you ask a question as well? Sorry.
Yeah.
You're muted. You're muted, Lyndon.
Sorry about that. This must be a first. Yeah, I'm a member of the Mid and West Wales Fire and Rescue Authority, so I'd like to declare that interest.
If you could fill a form in for us, that'd be great. Thank you.
Yeah, no, I will. Could I say, first of all, I visited the community safety village, Andrea, and it was really excellent. It really was worth a visit. With reference to progress made against each of the wellbeing plan steps since the last scrutiny session, are there any areas where delivery is off track? And what are the biggest risks to delivery in the next year? And how are these going to be managed?
Okay, Andrea.
Yes, firstly, Councillor Jones, thank you very much for the complimentary comments about the village and the success of it. That's appreciated. I will go again to step leads to answer the response in terms of the ones that they're leading on. So perhaps if I can go to Karen first in terms of early years services.
Thank you, Andrea. In terms of our overall work programme, we haven't got any major risks I need to alert you to. I suppose, as always with sort of early years, some of it's about sort of getting engagement with the families we really do need to reach. I think we can do a lot to go to families, and that's what we're trying to do in terms of the publicity campaigns, and then actually making sure that anywhere where families, schools, libraries come in contact with our services, we can then promote the offers and promote what we're trying to do. So some of our mitigation is through that targeted outreach, and we've got a face-to-face meeting of our early years steering group coming up now in December, and what we're actually doing in that session is mapping all our assets across our community in Swansea to see where we can then target getting our health visitors, getting our local authority teams to extend our offers and publicise it. So that's our plan to mitigate that risk that we see. Thank you.
Thank you, Karen. And in terms of the Human Rights City initiative, some of the risks include a lack of awareness, limited resources, and challenges in measuring the impact. So to mitigate that, we are thinking public campaigns, staff training, and integrating human rights principles into services, and regular evaluations and KPIs to monitor the progress, and hopefully that will mitigate that risk. For climate change and nature recovery, again, I'll go to Hywel.
Lovely, thank you, Andrea. Yeah, at the moment, there are no key risk areas, but of course the action plan we got is far-reaching and ambitious. I think there will be some challenges coming ahead. There's a lot of focus on local procurement of food, trying to develop and build on that. And, we're working with Neath Talbot Public Service Board on that. And that seems to be a bit of a key trend around much of Southwest Wales then, the desire to try and source food locally for the public sector. And I think there's some development work to be done with that. So far things are working very well generally. And, in fairness, Jane Richmond, who's leading this work on behalf of the authority, is doing an excellent job. So please to note, I do thank Jane for all the work that she's done in this area. So no key risks at the moment, but ultimately it's about building the confidence of the public and getting recognition of the challenges we've got in recognising, the climate threats we all face. I've seen in Monmouth through the last few days, and equally what you can do as members and what the public can do to help mitigate for that. I think that's the key challenge, and embedding that in everyone's daily lives. Thank you very much.
Thank you, Hywel. And then I'll come to Craig for an update on community safety.
Yeah, very similar to what we've heard from Karen and Hywel already in terms of no massive key risks here, but just relation to ongoing low engagement and limited resources certainly around some of the crime prevention and youth engagement piece. So as usual, certainly from a fire and police perspective and from a local authority, it's using outreach officers, It's harnessing the power of digital engagement and the active partnerships that are out there already. And where we can, we'll continue to secure some external funding to really make that difference. So that's it from community safety.
Thank you, Craig. And then finally from me, regarding the integrated cultural offer, there are risks in terms of delays in finalising the cultural strategy, unequal access to cultural activities and funding constraints, very similar in many respects to some of the other steps. But a mitigation of those risks will be clear timelines, stakeholder engagement, governance, oversight and expanded outreach. So that's it from us, Chair. I'm happy to take any follow-up questions.
Thank you for that, Andrea. Lyndon, do you have any follow-up questions?
Just one a point that Howell made about the amount of food that's sourced locally. I don't think it even hits double digits, so we've got a real job to do there, because it is important. I appreciate the fact that we've got to look at price, but ultimately, you know, we need to be getting that food grown locally and using it.
Okay.
Great, thank you.
Okay, thanks for that. Okay, Mary Jones on improving wellbeing monitoring. Are you there?
Yes, I'm here. Sorry, I'm trying to multitask, which isn't working very well. Can I just make the comment about the last question and answer? We had the climate change scrutiny this morning, and one of the, Councillor Williams was there actually as part of her role in that, and we were looking at renewable energies and things, and saying how much land were we going to lose, unfortunately, to some of the new technologies, and were we losing agricultural land? So maybe that's a point to take on board, that when we're looking at wind farms, solar panel, all this kind of thing, that we are actually not using the best quality agricultural land, and it is going on what I would call grey land. I presume it's got a proper title, but we were looking at car parkings and things like that as well. Maybe we should be thinking outside the box. Of course, my tablet has gone off as I was talking. So my actual question, though, is the improving wellbeing monitoring. How is the PSB using the new regional data portal and priority indicators to monitor population well-being and inform decision making?
Thank you. Yeah, thank you, Chair. Happy to respond. Thank you for the question, Councillor Jones. So as I said earlier, the data portal is now up and running. The link has been provided to our partners, and a demonstration of the portal took place on the 3rd of November, and then a follow-up session is planned for the 25th of November for anyone that missed the first session. Is a single source of truth for wellbeing data. The portal consolidates a wide range of local being data from PSB, local authority and the health board areas. And this means that the PSB partners can access up-to-date, reliable information without duplication, saving time and improving consistency in planning and reporting. So it's a really, really valuable, useful tool. It's supporting strategic planning and assessments. So the portal will serve as a key single data resource for developing the next wellbeing assessment, which is due by May 2027, and will provide comprehensive dashboards across the 8 main themes. And it enables partners to track trends and identify priority areas for intervention. So there's continuing monitoring and improvement, and the portal is designed for ongoing updates and maintenance, allowing the PSB to monitor changes in population well-being over time using a single source of up-to-date data, and feedback from users will be used to refine the portal's content and functionality. And this will ensure decisions are based on the most relevant and accurate data. And finally, in terms of facilitating collaboration and transparency by hosting Swansea's dashboard on the PSB web pages and sharing it with partners. The portal promotes transparency and collaborative working, and it also supports stakeholder engagement by making data accessible for consultations and for public reporting. So I can't stress how important and useful this tool will be for the PSB.
Okay, Mary? Okay, right. Wendy, you've got the question.
Sorry,
next.
I couldn't unmute. Yeah, thank you. I think
Oh,
that's, you know, a powerful tool, as Councillor Williams has said, and just hope you get the data you require from it.
Okay.
Thank you.
Wendy.
Thank you, Chair. Mine's external support. What is the purpose and expected outcome of bringing in external support for the PSB? How will the findings from the external total place project be used to drive improvement, and what changes can we expect to see as a result?
Thank you, Chair, and thank you to Councillor Lewis for the question. So the purpose is to support the Swansea Public Services Board in shaping its priorities and delivery for the final 2 years of the 2023-28 Wellbeing Plan. And the changes expected would be sharper priorities for 2026 to 28, a clearer collective understanding among the PSB members of where the partnership can add the most value and what priorities to focus on and what changes are needed, a practical plan for action and an increased PSB effectiveness. So we're very positive about this, and we think this will make a big difference and help sharpen those priorities and sharpen the PSB's focus.
Thank you, Councillor Williams.
Okay, thank you very much. Has anybody else got any questions for the PSB at all? No? Okay, can I thank you then, Andrea, for you and the various members of the PSB for coming along and answering questions. It's a very useful, interesting session. I'm glad to see that things are ticking away quite nicely for the PSB, and hopefully we'll see you again, see all of you again in about 6 months' time. Thank you very much.
Chair. On behalf of the PSB partners, we really appreciate the committee's interest in the PSB and the positive input and recommendations that you've made over previous years.
Lovely, thank you for that. Okay, so we're going to move on to the next item. It's you again, Andrea. Scrutiny of Cabinet Portfolio Responsibilities on Homelessness. Andrea is the lead member on that, as well as Joint Deputy Leader. We're supported by Carol Morgan, who is the Head of Housing and Public Health, Sarah Jordan, Landlord and Community Housing Services Manager, Steve Porter, Operations Manager for Community Housing Services, and Marie Muldoon, the Housing Options Manager. So welcome, everybody. We've talked about homelessness a number of times and last discussed this in September 2024. And we're keen to keep on top of what's being done to tackle, especially given the the situation out there is pretty grim, actually, in terms of the demand for council services and the number of people who are presenting as homeless. So, Andrew, do you want to say a few words to introduce this item or before we move into questions?
Yes, thank you, Chair, for the opportunity to come to Scrutiny again and talk through one of the subjects which is particularly close to my heart. And I just wanted to place on record, really, sincere thanks to the officers with us today and also the teams that sit behind those officers. As you've said, it continues to be a challenging area. The demand is not going away anytime soon. And so I'm really grateful to the teams for all the hard work that they're doing on the cold face. And the immense amount of preventative work that goes on that's often unseen in the background. So I won't say too much further, Chair. Obviously want to allow time for questions, and we've got a suite of people who are the experts in the field with us today who I'm sure will be able to assist with answering members' questions.
Okay, I'll start off with just a general question about what are the main causes of the continued rise in homelessness presentations in Swansea, and how is the council responding to those trends? I see Steve has got his mic.
Yeah, lots of it in the report, Chair, but there's sort of the increase of homelessness is everywhere. It's not just in one area. So, we've had 4,000 presentations for 4 years in a row. So domestic abuse is high, people leaving in prison is high, but parents asking people to leave is high. And that's a lot to do with there's nothing to move on to. So if there's nothing to move on to, then inevitably relationships will break down with parents, with family, with domestic abuse. So there's not one single reason why there's a cause of homelessness. If you're asking why is it, that's cost of living, increasing number of refugees, more people coming out of prison sooner, as well as the change of legislation 2022, really, which is the key change, which is why the numbers are so high, is that prior to 2022, certainly 2020 before the pandemic, we had no duty to non-priority people, to people who had no medical circumstances, no children, and therefore we would give advice, but we didn't have to provide temporary accommodation. So it all changed really when the pandemic hit, and then the Welsh Government changed that legislation. Arguably, the funding didn't fall in line with that, so we were able to strengthen it with more staffing around that time, but it hasn't kept up. So more people are in the system, but there is no one single reason why there's a cause of homelessness.
Okay, I was going to ask about legislation next and the changes to the priority need test is what you just alluded to, but there's also legislation going towards in the Senate at the moment, isn't there, which is going to also impact on the homelessness services. Have you made an assessment of what that's going to how that's going to look like?
Yeah, I mean, the good news is for us, I think it's fair to say that we've I don't like to say we've been on that journey. So we've had that no one left out approach before 2020, actually. So we kind of moved to not applying the priority need test before that. So the majority of people, so we have very few rough sleepers in the city compared to perhaps other larger cities. And so we've moved to a non-priority, to everybody's priority there. Not quite everybody at the moment. The legislation will have some impact to us in that area, but there will be other areas where we've got prison in our area, so there'll be more pressure around that and making sure we support everybody in that prison, not just people who are from Swansea within that prison. There's changes to the intentionality test, which will have a small impact on us, but not much because we don't make that many intentional decisions. So we're fairly robust when that legislation hits. But we will require, I believe, more staffing around that because more people will come into the system because it's now, if you're 2 months away from homelessness, we'll take a duty. Now it'll be 6 months. It's not actual legislation as yet, so there may be final tweaks to that. But if it is applied, then we're okay with it, but we will need to strengthen certain areas.
Do we know if the WLJ has managed to secure more funding behind this bill to help us cope with any changes?
I couldn't confirm that yet, Chair.
No. Everyone's nodding, saying we don't think so, and that wouldn't be surprising me at all. Okay, I'm going to move on then. Councillor Mary Jones on partnership working.
I thought Councillor Williams wanted to come in just now.
Oh, sorry, I didn't see Andrea.
Yes.
Do you want to come in, Andrea? So I do apologise.
Just in response to your question about WLGA asking Welsh Government for funding for this. Yes, we always work very closely. The current Cabinet Secretary is holding regional housing Cabinet Member Network meetings. And in those meetings, we often use those to do a soft lobbying for extra support and finances for all the new legislation and all the new bills which are coming at us, because, we're making the point constantly that if you want us to do more, then we do need resource to be able to deal with that and extra capacity to deal with the extra the things which the issues which the bills are bringing towards us. So we do continually ask for more finance and resource. Sorry, this is my third scrutiny today, Chair. So I'm scrutinied out.
You're doing very well, Andrea. Thank you very much. I think my experience when I was in the Welsh Assembly was that the finance assessments that went with bills were always very skewed towards the Welsh Government's not having to spend too much money and not always towards what happens going on in the real life. But you never know. Things might have changed in the last 10 years. We shall see. Okay, Mary, do you want to come with your question now?
Yeah, I can actually, with my question, it's how is the council working with partners, RSLs, voluntary sector, health, criminal justice to prevent homelessness and support those at risk? Can you give examples of successful prevention initiatives and what is being scaled up? And I have to say, I've been a council for many, many years, and I've never had to deal with people that have been made unintentionally homeless until the last 2 years. And that shows, I know we need to bring stock up to scratch, but it shows that the private landlords these are, because I don't have any council housing. It's just wrong that they can just put people out at the moment's notice, really. And I just hope that any bill will give people a little more clout so they can stay in their own homes. And they've done nothing wrong. They've been paying their rent and everything, and yet now they're being unintentionally homeless. So it's a bit of a minefield.
Steve?
Yeah, with partnership working, there's been a lot of partnership working in the last decade, really, particularly with the RSLs. I guess the best example of that is we've got a 50% nominations agreement with them. But when the pandemic and after that struck, we just asked our RSL partners to give us more properties, so increase that 50% to at one point 100%. So they were given at one point given all their properties to us because they realised that the pressure was on homelessness. So that's just one example. We've been working with Pobble to deliver Fleece Glass. We've worked in the criminal justice system and making sure that we have early intervention where people are coming out of prison, so early notification from there. So we have monthly meetings with the criminal justice system. Health, we work closely with health. We've got the rough sleeping team, which includes a homelessness nurse, homelessness mental health nurse, a substance use worker in Barrod who's dedicated to rough sleepers. So there's a lot of joint working. Is it perfect? Never. There's always room for improvement. I think where we've got to get to is really stopping people becoming homeless. We're great at, when people become homeless, moving them through the system. You look at the report, the figures bear that out. But we can't keep up. We can't keep up with the number of people coming into the system, and therefore we've got to find a way to stop people becoming homeless, and that does require all parties to get together, not just the housing department. It requires health and social services and criminal justice to say why are people becoming homeless in the first place. And in fact, we can only really get the figures down when we do that. And there is work going on. We're working with the mental health team at the moment on a wellbeing hub. It's early days, but we're in early discussions around that. Would a wellbeing hub be the next step that we go to sort of, we've got the people involved, but do we need to work with social services even closer to make sure that we deal with people with complex needs better? So there's always room to work. I missed the last bit when Mary's saying actually about
Mary?
Private rented landlords.
Can you give examples of successful prevention initiatives and what is being scaled up? And I think what we're trying to ask is, you've said obviously.
You've muted yourself, Mary. But I think you got a gist.
Sorry, I'm having awful problems. Am I either cutting myself off of the camera or cutting myself off of the mic?
We've got a prevention. We work with private rental landlords to try and keep people in their homes.
Yeah.
We don't want people to lose their private rented homes because there's nothing for them to get down the line unless they're in temporary accommodation for a long period of time. So we have a prevention fund that the housing options team work with. So we will give incentives to landlords, etc. Within reason. We can't just throw public money away. But if people get into rent arrears, we can assist with that. If they need bonds, we help with that, etc. So there's various strands of prevention. What I'm really getting to, I guess, is much before that is stopping people coming to poverty, stop people try and reduce people on taking substance use, etc. So that's really what we look at as prevention. We can help with the soft stuff, try and keep people in their homes longer, but really we've got to stop people losing their homes in the first place.
Is it my imagination, or is the private rented sector contracting a bit? And I've had a number of people who've basically been told they're selling the house, they got it, and
Yeah, it's not your imagination, Chair.
No.
It's an absolute nightmare. That it's probably one of the single reasons why we're not being able to move people on. So people can't, the private rented rents are just extremely high at the moment. Landlords have their own bills to pay, I guess. They've got their own expenses to pay, so they've had to raise their rents. But at the moment, trying to find a private rented property is extremely, not impossible, but it's difficult, particularly around single persons, one bedroom flats. And where the reasons for that, I guess, is the cost of living for landlords. It's the legislation, the Rent and Homes Act has made it difficult for them. Airbnbs is perhaps more attractive for some landlords, but some landlords are just saying they've had enough really and they want to sell it.
Yeah, because it also means that you're getting more families coming because they've been told they've got to sell the house as well. I think I've got a few examples in my ward and being aware of that. The other question I was going to ask, I mean, councils like Powys have got a single waiting list with all the RSLs. Have we looked into that? I think Powys is a stock transfer authority. I may be wrong on that one, but it is it? Yeah. So I mean that may be the reason they've got that. But have we looked at the single waiting list for all RSLs in the council?
We will have to. It will be in the legislation that all councils will be expected to have a common. Not a common allocations policy, a common register. So each of the RSLs will probably retain their own allocations policy, but everybody will come through us. So whether it's essential for us, I don't think it'll make that much difference personally. No. We already work well with RSLs. If we're required to do it in the legislation, there will be work needed to do that, to bring everyone together, having one policy, for example. But it will be happening in the next few years.
I can imagine having a common list but different allocation policies would be very difficult actually, because you're trying to allocate. Yeah.
It won't be much different to what we have now, Peter. No. Apart from, for the customer, it will be one place to apply, so it would be easier.
Yeah. Okay. Mary, you want to go next question or a follow-up question?
No, I haven't got a follow-up question. I've got the same comment as you had about more of the private sector being sold off. And I mean, it's the effect it has on the children. Some can stay in their schools because the parents can, probably get them there. And other children might have to change schools now 2 or 3 times until they're in a settled property. So I do take my hat off to those of you that have to deal with it, because it can't be very pleasant for you either. And, when you know that there are children involved, it must be very, very difficult. My next question is about more homes. We've moved on now a little bit. What progress has been made in increasing the supply of affordable and permanent housing, including through the More Homes programme and partnerships with RSLs and private sector?
This is you, Carol. Yeah.
Yes, I'll take this one. In terms of total completions of affordable housing, since 2021, 983 affordable homes have been delivered through the Social Housing Grant Programme. So that's a mix of council and RSL delivery. With More Homes, we've delivered 318 additional council homes, and that's been through a mixed strategy of new build, conversion of existing properties and acquisitions. So we've bought back 198 properties since the acquisition programme started. We've got a number of schemes ongoing at the moment at different stages of development. So we've got Brondig House, which is a former education site that's due for completion in February. And that's 13 units, so that's old. We're looking at Gosainen Business Park, so we've got pre-planning work on that, and also looking at sites on around Brooksby Road. And then we've got our ongoing right to buy acquisitions programme. And then in terms of partnership working with the RSLs, we're looking at 2 sites working with a local RSL. We are also looking at acquisitions. So for the first time, the council will be picking up 106 properties. So we're going to be picking up 12 units on the Gwynvine scheme, which you've probably all seen in the press. We're also working with the private sector and picking up 106 acquisitions with working with volume builders. So we'll be having potentially 141 units coming through in the next 6 to 7 years. There'll be a mix of social rent and intermediate housing. So it'll be our low cost home ownership offer, and that's the first time we'll have done that as a council. And we're also currently in negotiation with a private developer over a package deal. So I just also to say some of our sites may be affected by the marine sack issue, which was discussed in the scrutiny session earlier as well. So there may be slight delays to some of those schemes, but we'll look to put other schemes in the programme to mitigate against that.
That's the Natural Resources Wales directive in terms of nitrates going into the local estuary, isn't it?
That's right.
Which has to be sorted out before we can do planning on it, yeah?
Yeah.
Okay, just thought explain that for those who are watching. I noticed in the news that the Welsh Government have announced that they're not going to meet their £20,000 housing target this year. I mean, we obviously were part of that. And is that sort of common across Wales and some of the issues we're having? Because I think the other issue is we've limited on capital spend for a bit as well, which is going to have an impact on us.
Yes, I think that it's a common feature across Wales. There's new requirements, the nitrates, the construction costs that have just increased significantly since COVID. So everything's becoming much more difficult, really. So yeah, I don't think it's an issue that's affecting just Swansea, as you say.
Okay.
Yeah, Chair, if I could add to
Andrea,
that.
yes, go on.
Yeah, so no, just to support what Carol has said, again, I come back to those regional housing cabinet member network meetings with the CABSEC, and we do find there are common themes across all the regions. Sometimes there are specific challenges and barriers which are a little bit more intricate and more sort of locally based, but on the whole, the challenges are the same across the sector. And the other thing which has caused a lot of difficulty is the significant increase in construction materials, in terms of delivery. So we're delivering less and it's costing us more, which is essentially what's happening across the piece in Wales and in fact across the UK.
Do you have any indication when you're going to get your capital programme back, Andrea?
We're looking into it at the moment, Chair. I hope very, very soon. I know officers are redrafting, given that we've got better news with the Rent and Homes Wales Act.
Okay, that's good. Thank you. Okay, Wendy.
Thank you. How is the council supporting people with complex needs, e.g. ex-offenders, refugees, veterans, or those with substance use or mental health issues to access and and sustain accommodation?
A great difficulty, Wendy. It's not easy at the moment. People have considerable complex needs, substance use, alcohol, mental health issues, and list some more. We have a monthly meeting where we discuss complex needs cases with our various partners, so the voluntary sector, health, colleagues, probation, etc. So every month, there'd be sort of half a dozen, 10 people we discuss to see what are the best solutions for that person. But on top of that, there's MARAC, domestic violence MARAC meetings, MAPA meetings, which housing and social service partners are key to, really. So the most vulnerable households in the city, you can guarantee are discussed in one of those forums. But part of the reason why we felt that Llysglas and the second large city centre site that we're looking at is needed is because we don't feel the people in bed and breakfast are getting the right support. So it's not just because it's expensive to us, not because it's difficult to manage, but also because we feel that people are moving from bed and breakfast sometimes into their own accommodation and perhaps they're not ready for it. So we are hoping that the large scale supported housing projects where there will be considerable support put in, they will be better suited to move on, that have support early at the early stages of that tenancy, and therefore hopefully they will sustain that tenancy in a better way. And there's various other ways that we're managing complex needs. We've got a robust Housing First service which we've had for 5 years. That works well for the most part. Say it's perfect. Some people don't end up staying in their tenancies, or they might return to prison, but we're getting some really good outcomes there. And sometimes those outcomes aren't what we would think is a good outcome, but if take somebody who was sleeping rough outside the civic centre for a couple of years and was causing difficulty for us, for staff, for our waste services, etc., for various other issues. And eventually, by engaging with that person from week after week, day after day, you know, we managed to work with mental health teams to get that person into a mental health provision. Now, that might not feel a successful outcome to some, but it is, because now he's healthy, he was deteriorating physically. So, you know, supporting somebody into permanent accommodation is not necessarily the only answer. So there's various strands to it, and I could, I suppose, talk past tea time on this.
Yeah, I thank you for the answer, and I agree that that person you're on about was there for such a long time, and he even offered me chips one day when I went past. So I thought, you know what, he does like people, he just needs the right people. I just want to thank you all for the work you do, especially with veterans. So, and thank you for the answer again.
Andrea, do you want to come in?
No, I just wanted to, you know, thank Councillor Lewis for her work championing veterans. I know she's done a lot of work around the Covenant, which also covers housing as well. So thanks to Councillor Lewis for all her work championing for veterans. Much appreciated.
Yeah.
Thank you, but I don't think Marie will agree with you there.
Okay, do you want to move on to bed and breakfast, Wendy?
You touched slightly on this. What actions are being taken to reduce the use and length of stay in bed and breakfast accommodation, especially for families and vulnerable adults? Individuals, not adults.
Yeah, I mean, the figures in B&B aren't great, as you can see from the report. You know, we've got over 300 now in B&B, and you know, that's 10 times the amount that we had prior to 2020. I suppose the one thing to say on that is 90%, more than 90% of that, sorry, is single person. So at the moment, we only have one family in bed and breakfast. And that does compare quite favourably. And I don't like to do that with the local authorities. So from a family's perspective, we're doing okay with bed and breakfast. From a single person's perspective, that's the problem really for us. That's been the headache for us for quite some time now. So I guess Cleese and the other large city centre projects, 68 beds in Cleese, 76 beds in the other project, which we're still working with the Welsh Government and Pobl on that to get that over the line hopefully in the next month or two. If we can get over the line with that, that's going to have a dramatic effect, we feel, on reducing the numbers of bed and breakfast. It won't be down to zero, but it'll be a huge step in the right direction. So it's single people. I don't want to ignore families, but Carol talked about more homes. We did the Penland District Housing Office, converted that into 6 family homes. That's really helped with our family in avoiding B&B and stuff. So there's lots of things going on behind the surface, but with single people, we haven't cracked it. We're not going to crack it for the next year. We'll be back here saying we haven't got that down to anywhere near like zero at all, but we hopefully, with those 2 major projects and some other stuff that our HSG colleagues are doing about increasing the number of units in other temporary accommodation projects, then hopefully the landscape will change with B&B over the next couple of years.
When will Cleese be online?
It's bad timing, Mrs. Chair. I just took a call before that to say it was due to open. We were supposed to take our first person in 4 weeks' time. There's been a 2-week delay just because of the fire stopping issue. We've got to get it right. We can't cut any corners with fire safety. So we're looking perhaps now at the end of December, start of January.
So beginning of the new year, yeah.
Yeah.
It's a shame really, because people have to spend Christmas in bed and breakfast. Yeah. Okay, Peter.
Thank you very much. Afternoon all. Looking at the interesting graph on page 44, 2.6, and it compares B&Bs on the blue line to self-contained temporary accommodation on the red. One trend that is appearing is that the differential of time length is actually closing between the 2 modes. For example, in 2016, 2017, it started off with the average days was 20 in a B&B, and that's risen to 80. whereas in self-contained accommodation it was at 80, but it's risen, say, to about 120. So that gap's closing. So first point is, it's a little bit of a worry, isn't it, that we're, people are actually spending longer in B&Bs compared to self-contained temporary. Temporary is now getting longer and longer. Question: does the B&B figures also include hotels, or is that a separate category? And are we accommodating homeless people in big, in major chain hotels in the city at the present time? Because obviously, if you've got a mix when the hotels might be advertised for holiday makers and stuff, that you've got a mix in the hotel, we've actually got people with a different mode of living because they're living there longer, and your tourists will be a short stay. So those are the 2 points really. Are we using sort of big brand hotels? And have you noted the sort of convergence of the two lines? But to finish, I'd like to thank you, because it's obviously, it's a thankless task at the moment with, the vast increase in presentations for various reasons. So commend the department as ever on the fantastic job that you're doing, because it is a Herculean task for you all.
Thanks, Peter. Yeah, I mean, it obviously is a concerning trend for us, and that we didn't include actually this graph the year before, but we think it highlights the challenges that we've got really. So 40 days to 100 days in B&B, that's a 250% increase in time over 5 years. But that obviously is down to numbers, etc. So yeah, B&Bs does include everything. We don't try and cheat the system. That's B&Bs, hotels. We under the same umbrella. In other words, unsupported accommodation, if you like. The B&B's been really helpful to us. They've enabled us to meet our statutory duty, and if they weren't there, we wouldn't have been able to. So we can't. We're not criticising them in any way, but we just want to move to a better form of accommodation if we can, where it is supported. Yeah, and I suppose now we probably use upwards of 20 hotels. We're not allowed to name them for obvious reasons, but back in 2015-16 we were probably using about half a dozen B&Bs, and they were focused particularly on Oystermouth Road. Now they're across the city everywhere, and we will take what we can get at the moment, because it's that difficult to find a space, so that probably over 20 B&B stroke hotels that we use at the moment.
I'm aware of some mainstream hotels that have been used, people I've been dealing with. So, we're desperate to try and get people off the streets and get them accommodated, which, unfortunately is where we're at the moment. Yeah. Okay. Right. Lyndon.
Here we go. Audit Wales, really, how is the council responding to the Audit Wales report on temporary accommodation and recommendations? And are there any recommendations that require urgent action? And are there any of them that are challenging to implement? What already have been done, and what's planned? And is there a timeline and accountability for implementing the remaining recommendations? So quite a few points there.
Yeah, quite a few. Thanks, Lyndon. Well, there are 3 recommendations that they've made, Audit Wales, back in July, and that the councils are not providing value for money for temporary accommodation. Secondly, councils need to provide more robust, rapid rehousing plans. And thirdly, partnership work in preventing homelessness is often not effective. You'll probably see from the report that thankfully we're ahead of the game in certain areas there. So if you take the first recommendation, the value for money for temporary accommodation, we're well aware that B&B has been very costly to us, but it's not easy to come up with something like Cleese Glass. So we'd like to have opened Cleese Glass 6 months ago, 12 months ago, but there's been issues with the Welsh Government and making sure the property is fire secure, etc. So hopefully that is evidence to the Audit Wales Committee that we are trying. And there's not just that, and as I mentioned about HSG colleagues looking at creating different ways to provide other supported housing projects, increasing units, doing framework so that we've got robust provision in place for supported housing. In terms of the rapid rehousing plans, we've got HSG strategy to review by March, and no doubt we will make sure that the priorities are aligned to the Audit Wales strategy, which I think we are, but we'll need to make sure with some of our colleagues in social services that is the case. And partnership working, again, I've already said that there's a huge amount being done. Is it perfect? No. Are there areas we could work on? Perhaps better data, improving sort of things around with health colleagues, small things, but they make a difference. So I don't know, Lyndon, actually, in terms of we will have to make sure that we go before our audit, internal audit, to make sure it is in January. That's the Governance Audit Committee in January. To get everything in place that they want, it's going to take years. It's going to take years. But, bear in mind, the Audit Wales report is about 22 authorities, not about Swansea. So I would like to think that a lot of what they've said we're already either doing or in the process of doing.
Okay. Right. Thank you. And it's always, I think I've told you before, it's always good to have a list to work through. And I know you're a person that will do that.
Do you want to move on to the next question, Lyndon?
Yeah, no, I will. I think you partly answered this earlier, Steve.
Yeah, I think you did.
Yeah, what is happening with Housing First? We first talked about this about 6 years ago in one of the policy development committees. Are people moving into the accommodation receiving the adequate backup support? Are there cases where people are struggling to cope with being housed, and what support is in place to prevent tenancy breakdowns?
Yeah, so just to recap, back in 2020, we commissioned a Housing First provision. We were one of the first, not the first, but the first few in Wales to do that. And that's grown. I think we had 20 spaces there. Now it's gone to 25. So we've increased the provision for Housing First because it does work. It's really difficult because it tries to tackle that we were talking about a case earlier. It tries to takes the most difficult of cases, the most long-term entrenched rough sleepers, and tries to find suitable accommodation wherever that accommodation is. It has worked. I couldn't give you the figures at the top of my head, Lyndon, how successful it's been, but they're working with 24 at the moment, half of which are currently in permanent accommodation, some of which have got potential offers, some of which are in supported housing. One or two are currently serving short-term prison sentences, but it doesn't end there, the support. With Housing First, just because they go into prison, that we don't turn our back on those individuals. They make sure that their support is there during the time they're in prison when they come out. So it's difficult to answer, Lyndon. Each individual case is so unique, and that case outside the Civic Centre being one of them, that success can be measured in different ways. But I would say we are so glad that Housing First, we have that provision now. And ideally, we'd like to increase the size of that, whether it goes to 24 to 26 to 28 units, but that will depend on funding, and we don't know yet what housing support grant we're going to get. So these are the unknowns for us, Chair. So hopefully we can start increasing that slightly. We don't want a Housing First that's got 100, because we haven't got that many rough sleeping entrenched rough sleepers in the city, but we've certainly got, some more capacity for take on more units.
Is there a specific funding stream for Housing First?
It's housing support grant funded.
So it comes from that fund, so it's not actually ring fenced in there at all.
No, it's 100% from that housing support grant.
Yeah, so,
which obviously is.
So we have to spend that on other things as well, don't we?
Yeah.
Okay, thanks. Okay, Lyndon.
Yeah, no, great point. Thanks, Steve. I think it's important, as you say, to give those difficult to place people that extra support, and appreciate all the difficulties around that. And obviously it's working very well in getting people housed.
Okay.
Thank you.
Mike White, benchmarking.
Yes, thank you, Chair. Thank you. Yeah, my question, and be pleased to know this is the last question. On benchmarking, yes, Chair, I understand that. Yeah. how are we comparing with other authorities in Wales in terms of homelessness numbers and our performance in tackling homelessness?
Oh, Mike, I don't really like to answer this because, it's difficult to compare us with another. So could you compare Swansea with Anglesey, for example, or Paris? But now that you've asked, the problem is across Wales. It's not just with Swansea. It's not just with Cardiff, Newport, and Wrexham. It is across the board. People, the presentations are high in every authority. The number of temporary accommodation is high. So if you want some figures, Newport have got 342 people in B&B. It's single people and 84 families in B&B. That was at the last, I think that was the snapshot at the end of March 31st. So as I've already mentioned, we've got 300 in B&B and one family in B&B at the moment. Caerphilly have got 39 families in B&B at the end of that same period. So from a family perspective, we certainly are favourable. But again, I really don't like in Cardiff, went down the road of buying hotels and turning them into supported housing projects, and quite a number of hotels, so 7 or 8, 9 large buildings, and you might have seen that in the press recently. So but Cardiff have obviously larger numbers, a larger authority, larger people migrating to the city than we have. So if you want to take the figures starkly, we're probably doing okay, Mike, in terms of rough sleeping as well. The average number of rough sleepers at the moment, I think, is probably 9.2 only one night. Again, that's probably favourable to other authorities, but it's with a caveat that
when I first got involved in homelessness back in 99, 2000 in the Assembly, I think most of the authorities around major population centres were dealing with it, but the other areas were sort of letting them get on with it. So I think we get a situation now where all the authorities are having to face up to it, and they've all got obligations. So it has been an improvement across Wales, in my view. But I think Swansea's always been ahead of the others in terms of that. And Andrea will no doubt confirm. Andrea.
Yes, thank you. No, I just wanted just to add to what Steve has said in terms of having that WLGA perspective across Wales. In 2019, we had around 4,000 people in temporary accommodation across Wales. And now this last year, we're looking at over 11,000. So that just paints a picture of how staggering the figures are right now and how homelessness has increased across the board. But yeah, I agree with Steve. It's very difficult to quantify where we are. But what I do know, and I am confident in terms of the regional network meetings, is in many respects, in many areas, we are leading the way. And our shared good practice is shared amongst other local authorities. And, they watch Swansea very closely. So something that I'm extremely proud of our track record and the way that our teams are dealing with the housing crisis generally, which is happening across the board. So hopefully that gives some comfort.
Okay, Mike, did you want to come back on anything?
Oh, I know there's going to be added pressures with obviously Section 21 also has been done with private landlords now as well. So I know that's going to put an extra burden on the council's housing sections as well.
Yeah. Okay. Right, anybody else got any questions on this? I think we've covered this area quite thoroughly. So can I thank the housing team and Andrea for coming along and answering the questions. It's been very useful. I think, we do think it's a major issue which we want to keep an eye on from the scrutiny point of view, because, it is a massive problem for not just for Swansea, but for the whole of Wales. And I think we need to know we're moving forward and dealing with it as best we can. So thank you very much for everything you do. And thank you for coming along, and have a good Christmas.
Thank you, Chair. Thank you, committee.
Okay, so we're going to move on to item 8, which is the annual report on corporate safeguarding. And can I welcome Councillor Louise Gibbard, who is in the room, and Dave Howes, the Director of Social Services, also in the room, along with Simon Jones, the Social Services Strategy and Performance Improvement Officer. That's quite a title, Simon. Okay. Do you want to say a few words, Louise?
Yeah,
introducing
thank you.
this?
I'll keep it brief. 'Cause I know you've got a number of detailed questions which are going to bring out some points in the report. So yeah, first of all, obviously, my big thanks to Dave and Simon for putting the report together, and you know, to all council staff and indeed members for their continued commitment to ensuring safeguarding is a priority across the council. And as we say, that it's everybody's business. It's always really good to bring this report forward. It's a good story to tell, I think. Our own internal audit and the section 135 self-assessment shows that we have got these really good, robust safeguarding arrangements. And it's also nice to note that when CIW inspected adult services this year, they highlighted the good practice in our safeguarding arrangements. We continue to have some really good collaborative work with partners in the West Glamorgan Safeguarding Board and other agencies. And I'm always really keen to emphasise the key feature of having people's voice at the heart of our safeguarding processes. So I'll pause there and we'll pick some of the points up in the questions.
Okay, well, I'll start with a general question. What are the main achievements and improvements in corporate safeguarding arrangements over the past year?
You happy for me to
Highlights?
pick up and you pick things up? Yeah. Yeah. So I think that's the whole report really. Hopefully, is the achievements and what we've been doing. But yeah, so the policy's been refreshed to reflect the national legislation, the training standards, and emphasise our whole council approach. And there's a much greater focus on prevention and extending the duty to report to all our public service officers. The key elements for effectiveness have been strengthened: the safe governance and performance, employment, workforce practice and partnership, and safe voice. We have, as I've said, robust arrangements for responding to and managing safeguarding concerns, supported by really clear policy frameworks, structures and lead roles throughout the council. The corporate safeguarding group and operational group have renewed their focus, updated terms of reference and proposed an updated work programme. The performance dashboards and frameworks developed to monitor safeguarding activities in real time. As I mentioned, the self-assessment confirmed all of this, and our internal audit awarded a high assurance rating, confirming that procedures are operating satisfactory and controls are consistently applied. And good practice examples are highlighted in the report, like as I've said, the multi-agency working. Our trauma-informed approach is really good practice, and embedding our human rights and children's rights work into all council work. I don't know if you want to pick anything else up I've not mentioned.
Dave, do you want to add to that?
Yeah, no, great summary from the Cabinet member. I think for me, it's not necessarily an achievement for this year, but it grows each year. Approach has said that we really want to embed a culture in the organisation where this business isn't just left to social services or very obvious services like, education, safeguarding in school. So one of the things that still stands out for me is Louise and I co-chair a board that brings together officers from across the council to drive forward contributions to that culture of safeguarding is everybody's business in the council. And it's still a really well attended, enthusiastic group with people bringing new stuff. And it's quite, I know you'll ask us questions rightly about, what's the plan, etc. Well, some of it just evolves from what the enthusiasm that our colleagues from across the council bring to the party. And that, I think, is a huge achievement for this council. I'm not sure if, Welsh Audit Office, etc., came in the way that they did many years ago when the focus really was turned to corporate safeguarding as a function in itself. I'm not sure that culture would be as evident everywhere across public services in quite the same way is evident in this council. Don't know, be interested to find out. But I think we should continue to be really proud of that.
You can always invite them back, Dave.
They'll come back, I'm sure.
I know they will, yeah. Mike, do you want to ask your question?
Thank you, Chair. Yeah, my question is regarding the safeguarding training in schools. Last year, obviously, we had a discussion on this when you last attended. What I'd like to know is, what is the approach to safeguarding training by schools and take-up? Do we have an effective system for monitoring, tracking, compliance regarding school staff? governor training, and is the approach and take up with school satisfactory? And if I can trust after you give response, if I can give an explanation what I think perhaps might be an option.
Well, education colleagues have given quite a detailed response. I don't know, it's about a page long. I don't know if you want me to read that out, or perhaps it might be better to give you in a written response. The short answer is yes, confident that the training, they've made some changes to how the safeguarding training is rolled out across schools this year, and it's and they are confident that it is going ahead as planned. But I don't really want to read out the whole page answer.
We'll put the letter in our letter, and you
Okay.
can respond in detail.
And then, unless Dave or Simon want to give a shorter version.
Dave might want to come in and add to that.
I'll summarise just so you've got immediate assurance, but I think Cabinet members right. It'd be good to share the detailed response. Part of the context is the expectations around what good safeguarding training should look like have been revised. So all of us have been embedding those new criteria across all of the training, and our education colleagues have really embraced that. It's effectively 3 levels of training. The basic level of training, which is called Group A, we are absolutely confident from the records that the safeguarding team in education capture that all school staff have had that basic training. So that's great reassurance to begin with. Then it effectively goes up in criteria. There's a higher level of training that's described as Group B. We know that about 2,000 hours of Group B training have been delivered across school. It doesn't give complete coverage yet. There's a good programme in place. And then there's a higher level of training again, which encompasses a range of training. It covers the Bowder SB stuff, some other stuff as well. Gets up to something like 6 hours of training overall for school staff. Now that'll take a while to embed that, but what we do know is there's a really good plan in place. So it's began, the rollout of that's began. It'll probably take about 2 years to embed full coverage. But as a corporate safeguarding group, we take great reassurance from those arrangements, and I think you can as well. But that detail that Louise has described will forward. And I apologise. I think you did ask the same question last year. I think we possibly missed a response. That might have been the confusion around or some of the change about I was off for a while, wasn't I? So apologies for that. We will make sure we send the response, or support the cabinet member to send that detailed response through.
Okay, Mike, did you want to come back?
Yeah, no, I was just flagging up, Chair, because I know that we was sort of mentioned, plus we could have schools set aside an inset day where it captures all the staff that work throughout the school, and also school governors as well, you know, so everybody involved with the overseeing of schools would have had the safeguarding training.
I'll come back on that, Chair. Sorry, I should have covered that, Mike. That is an arrangement that's in place. So one of the inset days at the beginning of the school year attempts to do that. So that is in place for the majority of schools. They don't get complete coverage. There's always some churn of staff, etc., etc. So there's some mop up through the year as well. But one of the reasons that we've got that complete coverage of that Group A training that I mentioned is because of exactly the methodology that you've described. The use of an inset day at the beginning of the school year to get as many staff as possible covered with that basic level of training, and then additional training is built on that through the year.
Okay, Mary, do you want to come in?
Thank you. Yes. Can I just flag something else up? Actually, I'm chair of a big school, and we offered the governor training in our school, and we invited all our cluster primaries to come and do it. So we did it all in one lump. Again, we didn't get everybody for different reasons. Not everybody's safeguarding training is up at the same time. But it might be an idea for those of you that are on comprehensive schools to get your schools to do it specifically for your governors, not for the staff. And it worked very well. We've done it once before, 3 years ago. So it is something that we've tried and tested. And again, as I've been talking, my screen has gone off for my question. So I should learn not to talk. All right. My question is on about staff and member training compliance. What are the latest completion rates Has the new Oracle system improved oversight and reporting? And what steps have been taken to increase compliance? And are there persistent barriers?
So the current reporting from Oracle does show the number of council employees who have completed the mandatory e-learning courses within each service area or team, and managers there are expected to monitor the compliance in their own area. The issue is that Oracle provides team level completion data, but not individual records. So corporate services are proposing to implement the new, I don't know how to pronounce it, ThinkChi, I don't think SIS training platform, which is hopefully should be better at tracking that. The sort of steps to increase compliance include mandatory induction programs, different training approaches, face-to-face, virtual, checklist, helping staff identify the training levels. But yeah, the persistent barrier is the limitations of the current reporting systems, unfortunately. But we'll see how the new system works, basically, in a word.
Okay. Okay, so when councillors refer safeguarding issues, which I think does happen occasionally, do they get the relevant feedback confirming action has been taken? Because I'm not sure that always happens.
It's difficult because obviously we can't we can't breach confidentiality for individuals. Any referrer, including a councillor, should get a confirmation that yes, that has been taken on board, and that a response, has been taken. But we can't promise to give any more detail than that, obviously, as for confidentiality reasons. But hopefully we can have that reassurance that they will all be acted upon.
They'll all be dealt with appropriately. Yeah. Okay. Mary. Again.
Yeah, mine again is suppliers and contractors, and considering you've said a few times, and we all know that safeguarding is everybody's business, a lot of people don't think it's their business. So I just wondered how you actually manage that. But the question is, how confident are we that all suppliers and contractors understand their safeguarding responsibilities? Is there now better evidence of compliance in less obvious areas? Has the new contract variation to strengthen safeguarding provisions been fully implemented? Bit of a mouthful, sorry.
Well, all suppliers engaged by the council have contracts that include safeguarding awareness and understanding. As you know, that's a provision in the contract, and this is monitored by commercial services working in partnership with audit. So it does, as it states, that is stated in the report. So and it's actively monitored. So I would like to say yes, that it is in place across all contracts, and obviously colleagues are monitoring that. I don't know if you've got more to add on that. I don't really have any specific data, I'm afraid.
Dave.
Yeah, check that. As the cabinet member said, we have got a position now where it's a standard clause.
Good.
And so when you enter into a new contract, you, as a supplier, you need to explain, as you're entering into that contract, how you intend to satisfy that criteria. It's always difficult to do the ongoing monitoring of that, because effectively the ongoing monitoring would be, well, if there's a breach of one of those criteria, then we'd be following it up. So what I'd say is we've not got any evidence of breaches in those areas that are more peripheral, I guess, to direct care, for example. We do know that occasionally it's a failure to deliver against a, that's a bit overstating it a bit, but concern about responding appropriately to safeguarding matters in those more direct care arrangements. And we've got very clear processes of escalation and monitoring, etc., to make sure that they are taken forward. So in the areas where we've been most concerned, we've got evidence of it's spotted, the issues are followed up, the issues are addressed. Otherwise, we cease dealing with those companies. In those peripheral areas, you have to make the case when you enter into a contract, and we haven't picked up any obvious areas of failure in those areas.
I think this is an area which we've been focusing on as a scrutiny board for a number of years, and some contractors do come across vulnerable individuals, for example, working in council houses, when it's improvement working in council houses and stuff like that. So we do need to make sure that they're aware of their responsibilities when that happens and react appropriately, I think. Yeah. Okay. You okay, Mary? Okay,
yes, fine, thanks.
So we go to Wendy next then.
My question is about corporate safeguarding group actions. Has the review of the operational group, its role, purpose, terms of reference and membership, and updated work programme been completed? Are quality assurance frameworks in place?
Yes, so one word answer, but yeah, so I think as it states in the report, it has renewed its focus in terms of reference and the group membership and proposed an updated work programme. These frameworks are being embedded with the ongoing development of case audits, and as I said before, they're really important part of capturing the voice of our service users or individuals and people working with safeguarding concerns. Yeah, so we've got a revised work programme from September 25, and that sets out clear actions, leads and timescales for each work area. So yes.
Okay.
Okay, Lyndon?
Great,
So
thank you. What are the main areas for further development or improvement identified by self-assessment and audit, and how are these being addressed?
So the things that were picked up through the self-assessment were things like communication and deployment of revised HR policies, including recruitment and selection, DBS and volunteering. As I've just mentioned, that embedding of our quality assurance framework. The continued improvement of capturing staff and elected member compliance of mandatory training, as we just talked about with Councillor Jones. Consistency in applying professional concerns across all council services. Further development of our advocacy offer. I think that's a really key part, again, about getting that voice included into the process and those what matters approaches, and routine reporting of safeguarding compliance and quality information. So all of the actions are included in the work programme that I just talked about with Councillor Lewis, and we've got ongoing development of these frameworks and reporting systems. So yeah, as I said, I think we have got really robust processes for self-assessment and actions coming out of that.
Okay.
Good, thank you.
Mary, the last question, I think, unless other people have questions. Mary Jones, you there? Disappeared. I'll ask the question.
No, I'm here actually, sorry. Jeff was ringing me on my mobile. He's only in the other room, but he obviously needs something. Sorry. The last question is, what are the key priorities for strengthening safeguarding in the coming year?
Trying not to repeat myself, I think we've picked up on this from some of my previous answers, but yeah, so ongoing development of the work plan, follow up from the Section 135 audit, and with annual reporting and performance indicators, continuing review and development of professional concerns processes, a language policy for schools, implementation of recruitment and selection policies, volunteering policies, and the new training system, as we've already referenced. Continuing to update induction, voucher SV training, trainer training opportunities, strengthening our interagency collaboration, keeping up with those meetings with the safeguarding board, continuing sharing good practice, and as just flagged about advocacy work and our trauma-informed practice and voice of service users. So yeah, it's hopefully clear in the report. So a summary there.
Okay, Mary. Okay, so anybody else got any questions? Good. Can I thank you then for coming along, and see you next year most probably. But certainly we feel, I think, more assured in terms of how safeguarding has been moving along since we started this process some years ago. So that's really good. Thank you very much indeed. Thank you. Okay, let's move on to item 9, which is the Scrutiny Performance Panel Progress Report. It was meant to be Service Improvement, Regeneration and Finance, but Councillor Chris Holly's been unable to attend today's meeting, so I'm proposing that we defer this item to the next meeting. We're agreed on that. Now, item 10 then is the membership of scrutiny panels and working groups. There's one change. You need Councillor Tony Fitzgerald has been asked to add to the Service Improvement, Regeneration and Finance Scrutiny Performance Panel. Are we agreed that should happen? Yeah. Okay, and just to note that Councillor Hannah Lawson has been appointed as Chair of the Climate Change and Nature Recovery Service Transformation Committee. It's a long name. for the remainder of the municipal year, and therefore will be removed from any scrutiny panels or working groups for the duration. And the committee has deferred agreement of the membership of the new scrutiny inquiry on cost of living and community resilience and the new scrutiny working group on taxi services at the meeting in September, pending further expressions of interest from councillors, and that will be reported back to committee in due course. Unless any other issues on that item, I'm going to move on to item 11, which is the scrutiny work programme. The next meeting is in December, on the 9th of December, and we're going to be looking at the Children and Young People's Rights Scheme Progress Report 23 to 25, and also the Complaints and Compliments Reports for 24-25. We've added a session on school transport to the March committee meeting to enable questions to Cabinet members on relevant issues, including service provision, costs, accessibility and availability of seats to purchase, etc. And also we've got reference to the in the report, the findings of the Council's recent panel performance assessment, which reflects very well on scrutiny in Swansea. So the people who came in were very impressed with what we're doing in scrutiny, and were also impressed with what was going on in governance and audit committee last month. So well done to everybody involved in that, particularly the staff who provided so much support to all of us in doing that. Item 12 is scrutiny letters for information, and item 13 is the date and time of upcoming scrutiny panel working group meetings, which is also for information. So can I thank you all very much for attending. I will see you next in this committee on Tuesday, the 9th of December at 4 o'clock. Thank you very much indeed. Thank you, everybody.
Thank you, Chair.